Hi guys, and welcome back to Self-Care for Better Health. I'm your host, Dr. Alice Kamau, and today I'm hosting a psychiatrist. He'll be taking us through bipolar disorder. So welcome, Dr. Ali. Please introduce yourself and without any delay, take us through bipolar disorder.
Thank you very much, Alice. Let me start by mentioning my names. My name's Dr. Njagi Commander. I'm a psychiatrist, and I'm also an addiction specialist. I've actually been in this field for some time. I've also held positions of leadership as well as mental health is concerned in Kenya. I was once the director of mental health, or director of Mathare Mental Hospital. And so I'll be talking from what is on books and also from the experience I've gone through as I handle patients who have been suffering from bipolar disorder. Currently, I'm stationed at a rehabilitation center. To be specific, is a mental health facility called Brightside DART Center in Kitusuru. And this is where I'm operating right now as the director of the institution. So going directly to bipolar disorder. Basically, bipolar is in disorder of the mood. Either you are too low, sad, depressed, or you're on the other side feeling very happy with yourself, energetic, full of ideas, and feeling like you're at the top of the world. There are about 4 types of conditions described under bipolar disorder. One is bipolar 1. By bipolar disorder 1, this is normally an episode of mania, feeling high, and it is a very severe condition because it comes in an aggressive manner, and you may have psychotic symptoms like hallucinations or even delusions. So it comes where you feel you have to do things your own way. Nobody should tell you what to do, and it's a very dangerous condition. And it normally ends up with admission into a mental health facility because you can't cope with the people. Bipolar 2 is usually some kind of a depression.
So hold on. So what you are trying to say is in bipolar 1, you don't experience the depression episodes?
There's no depression episode.
Okay.
You just come when you are high, you are manic, you want things done your own way, you can't listen to anybody, you have to tell people. You are full of energy, full of ideas, you keep on talking, and really anybody comes your way becomes a victim. That's why we say they become aggressive, and they need to be admitted into a mental health hospital so that they can calm down and they can be able to live with the people, because they can be dangerous to others and to themselves. In bipolar 2, it is usually a depressive phase, but we get episodes of mania.
Okay.
You don't just remain depressed throughout. There comes a time when you are a bit high and you are able and you feel good about yourself. So it's not as dangerous as bipolar 1.
Okay.
That's why it is called bipolar 2.
So now here you'll find that the high and the low periods, they are alternating.
They are alternating, but the depressions are more. They last much longer than the higher part of it. And because when you are depressed, you are suffering inwardly, you are not likely to provoke the people around you to take you to a hospital because you are suffering. It's you who is suffering. You may not even need to go to a hospital because you don't think there's help. You have lost the hope, you hate yourself, and you feel worthless. So these ones are not always being taken to a hospital
So
because they're
that's
not very aggressive.
okay.
And in fact, they'll be taken to a health facility because they are not functioning. Things are not moving the way they should. If it's work, they are not going to work on time. They can be laid off. And then you decide now you take them to a hospital. There's one which is called cyclothymic. This is the one which keeps on changing. Actually, within one day, you can be depressed in the morning, and in the afternoon, you are very happy, laughing, and feeling good about yourself. Next time, you're in tears again. This one comes more with young people, adolescents, early adulthood. Then we have a bipolar condition, which is induced by drugs. Things like marijuana, alcohol, even other illegal drugs like heroin, cocaine. You take them, after some time, you lose your senses, and you can come in a manic form.
So drug abuse can induce?
It can induce. It can induce a highness. It can also induce depression. And you find yourself in depression. So those are basically the 4 conditions which we talk about.
Let me take you back a little.
Yes.
Are the patients able to monitor the mood changes or their behaviors? Do they notice that now I'm getting into a depressive episode?
No.
Or a manic episode?
No, they are not able to detect because bipolar disorder is a severe mental illness. Actually, it is number 2 to what we call schizophrenia. There are 2 types of severe mental illness, schizophrenia and bipolar. When you are suffering from schizophrenia or bipolar, you do not even know you are sick or you are mentally sick in the first place. These are the people who are even taken to the hospital under what we call involuntary terms. They don't say, I am sick, let me go and see a doctor. They are sick to a level that they are not aware they are sick. So they are insane. They are not sane, they are insane. So anybody with bipolar does not know he or she has got a mental illness. In other words, they lack what we call the insight. And insight is an understanding that I have a problem. The second group of mental disorders are the ones people have a problem with the mind, but they know they have a problem with the mind. So those are mild or moderate. Those are not severe. So as soon as you mention bipolar, we are talking of somebody who is mentally sick and they are not aware they are sick. Actually, it is the close relatives who realize there's a problem with this person, and they are the ones who seek help for this person. I think that is message is very, very important. We don't give the burden of seeking help to the sick person. It is the relative, it is the significant others who help this person to get treated. I hope I'm a bit clear. I'm a bit clear on that area.
Yeah, you're clear, I get it.
Now the question is, if you have this condition and you really can't stay with the people, you are a danger to yourself and to others.
Yeah.
The first step is to get help. So you must be taken to an institution or to a psychiatrist who can manage this condition. And the psychiatrist will do their own kind of assessment, but it is basically based not on laboratory tests, but the information they get from the relatives. We call it history taking. This person used to be quiet, not talking. All of a sudden, he is very talkative, he is full of ideas, he has changed. So the history is the one which informs the psychiatrist what they are dealing with. Of course, the psychiatrist will try to dig out what may have precipitated this. It is well known that most of the mental illnesses, they run in the family. They give a figure of about 60%.
Okay,
in
so there
bipolar,
is family history.
about 60% there will be a family history of mental illness. But family history per se does not mean you get mental illness. It simply means you are vulnerable. If the environmental challenges are there, you are vulnerable and you develop this condition. So the illness is not caused by genetic factors and it is not even caused by the environment alone, but the interaction between the environment and the person, because they have a weakness in them, so that when they are challenged, they succumb to this.
So the more risk factors you exhibit, the more you are at a risk.
At a risk, yes. And more often, it is actually the upbringing factors and the way you are brought up. Because if you have been traumatized, you went through a very challenging lifestyle, it's like you are too sensitive to things going wrong.
Yeah.
So that even if you get a small challenge, it will overwhelm you.
Yeah, you're not
Because
able
you are adding
manage.
to already something which has been there. These people have been traumatized, and then you are bringing some other problems to them again. And that one just making them break down very fast. So the upbringing can help. Some people have been traumatized. Others have not faced the hardships of life. It's also good to face life as you grow up.
Yeah.
Because you become a bit...
You'll be hardened.
You'll be hardened, you are prepared. Whatever comes, you have handled similar situations before. That's why you hear like some people who are overprotected.
Yeah.
And they are a bit spoiled. They have never faced life.
They are pampered.
Life has been too sweet for them. All through, they have never faced life. So when you just get a small challenge, it is too much for you. So if you are vulnerable, you find yourself breaking down.
Okay.
It may not be the issue of upbringing. It might be the way you plan your life. Some people plan life the way they would like it to be. We call it ideal situation. The ideal person you want to be. But you may not be made of that material. Sometimes we aspire to be something because so and so reached there. We want to be there. Or we adore that person.
Okay.
You may have a role model and you want to be like that person. And you assume you are going to be like that person. But you are not made of that material. You don't have the potential. You can't reach there. So it's good to be realistic. So you assess yourself, what you are capable of doing.
Your abilities.
And you plan things which are achievable to you.
Yeah.
The thing is to know I can achieve this one. And you work towards an achievable goal or an achievable target. If you just have a passion because you saw somebody and you admired, and then you say, I have a passion. I want to be a musician. I have a passion for music. But are you really gifted? Are you talented in music? You may not. You just like and you feel like you want to be like this. So by understanding yourself, you don't base it on your feelings. You reason out. You rationalize. You intellectualize. And you even seek opinion from other people. What do you think about me? What kind of character are you? What kind of potential do you have? So if you know yourself proper, then you go for things you can be able to achieve. And if you achieve, then you are happy. And the happiness will keep you going on. If you go for things which are out of your reach, you'll be frustrated. As soon as you're frustrated, you'll be stressed.
Yeah.
And if stress continues long enough, stress can lead to disease. It can lead to depression. It can lead to bipolar. Even other conditions like anxiety. And let me Now, and that bipolar is basically a disease of the mood. Bipolar is actually a result of challenges in life. It does not come out of blue, like schizophrenia. Sometimes you are not sure whether schizophrenia comes from, but bipolar, somebody has been struggling to reach somewhere, and you fail to reach. When some people fail to reach, they give up. When you give up, you are in burnout, you are depressed. Some people don't give up. They are go-getters. So when things are not working well, they come out with a self-inflated ego. Me, I can't fail. I'll do this, I'll do this, and do this. So there are some people who don't give up when things are not right. So they come up with a manic state. A lot of energy is the struggle to sort out this problem. But you see, this energy, sometimes you do too many things, you talk too much, you lose your voice, you walk too much, you work a day and night, and in the end you get exhausted. Actually, some people just get exhausted because they have no time to eat. And from there now, they succumb to this disease. So bipolar is actually a form of depression, but these people don't accept they are down. So they take an attitude that they are high, they are on top of the world. Instead of accepting I failed, they take it like I have not failed. I'm actually at the top. So it is a disease, because instead of accepting where you are taking yourself as you're on top of the world, when in reality, you are under the world.
So the major cause, we can say the major cause is life challenges, disappointment.
The environment.
The environment.
Environmental factors. Environmental factors, they interplay with your genetic makeup. And your genetic makeup is not just genetic, it's who you are. What have you gone through as you grow up? You know, there's a Swahili word, mtoto vile aleavyo, ndivyo akuavyo. Sometimes even these genes may not be the genes per se, because there's a way of bringing the children. The way your parent was brought up is the way this parent is going to bring up her children. It could be a pattern of traditions, yes. If you are from Kisii, they have a bit of more aggressive.
Yes.
If you come from Meru, it's the same. They are short-tempered. And you just abuse somebody is taught. In Meru, it is taught during the initiation, the circumcision, that if you are a man, you must not tolerate any abuse, any insult from anybody. And if somebody insults you, you really have to work on that person. So what we call genetic sometimes is not genetic, but the traditions and the cultural expectations and values, they are the ones which are to play. And they will determine how you react to challenges in life. Yes. So, is it treatable or not? Now, one is not born with this disease.
Condition.
It comes because of several factors. If we address those factors, because they came and before they were not there, there's no reason why we should not get 100% treatment rate. Even now it is known about 3/4 of people with mental illness, they recover and they're able to move on with their lives. About 50% they recover completely, you don't see this condition again. Another 25%,
it's really good news.
They can relapse, but they know how to get help, and they get help and their life continues. About 25% are the ones we can call chronic. Those figures were there maybe some 25 or 30 years ago. But some of us who have been in this field for some time, we have also been trying to understand why people are not relapsing. And it has become clear now that there are two areas which must be concerned. Anybody with mental illness has got a problem with the brain. It is no longer now just the mind. It has been found there's some things we call neurotransmitters.
Yeah.
For a message to move from one nerve to another, it communicates through a neurotransmitter. And there's a gap between the two nerves, which is called synaptic gap, synaptic junction. So for that message to cross over, there's a chemical reaction because there's a messenger which passes through some fluid to stimulate the other nerve. And these neurotransmitters have been found to be reduced. People who come with a psychotic condition where really you are not yourself, they have a problem with a neurotransmitter called the dopamine. And the medicine we give for people who are psychotic, we give medicines which work on dopamine. They are called antipsychotics or major tranquilizers. So they ensure that this dopamine, which is low, it is elevated. And when it is elevated, the psychosis disappears. People who come with moods which are exaggerated, either you are too low or you are too high. We have found a chemical called serotonin. And we have medicines now we call serotonin reuptake inhibitors. So when the levels are low, you are depressed, and we elevate them for you to feel normal. People with anxieties, there's a lot of change in some kind of brain adrenaline called norepinephrine, which works through the brain. So when we have those anxieties, when we give you the medicine which works in those areas, the anxiety is controlled. So somebody who has got a major illness like bipolar, the treatment must involve some medication. We call it pharmacotherapy. And you are a pharmacist.
Yeah.
Alice,
It involves medication.
So some medication is a must. There are people who avoid medication. They'll go for prayer healing. And they'll go to consult traditional medicine men. And some will even go for spiritual healing to cast away the demons. This is not an issue of demons. It is an issue of chemical change.
And how do you deal with those patients who don't adhere?
First of all, I'm trying to say this person must go through, if there's a chemical imbalance, it must be corrected in a chemical way. So medicine corrects the imbalances in the brain. And these people now are able to clear up, and they are able now to be themselves. They're stabilized mentally. They are back to understanding who they are. Once they know who they are, that may not be an end by itself. You have to tackle what made you sick in the first place. So now you have to get an understanding of yourself and what happened to you. If you are traumatized as you grew up, you have to know this is the way it happened. And there's a way of trying to go through that with the help of a psychotherapist. If it's understanding yourself, a psychiatrist can also make you see things you can't see or understand things you could not understand. Then from there you are able to know what precipitates this condition. So you must have a combination of medication and psychotherapy. You must have the two. And normally it takes a bit of a long period, even when the depression is gone. When the mania is gone, you need to continue for 6 to 12 months with that medication and a bit of that help so that you can adjust to a normal life. So it's not something you can change within a week or 2 weeks. It's something even when you settle down, you are able to continue seeing your therapist, receiving your medication, until now the condition is more or less balanced. And again, you see, during that period, whatever was precipitating, like now we have the COVID-19, it has really disrupted a lot of lifestyles.
Yeah.
It has messed the careers of people. Some have been having this business for a long time. Somebody could be operating a bar. I'm not advocating for alcohol, but his livelihood has been on that bar. And it has been closed for 6 months. The business has collapsed. Those people now who have problems to come back into where they're supposed to be. But if they're helped and then they're able to restart where they are again, then you might see this thing now goes. So that's why I'm saying psychotherapy is important, and also the medication. They must be combined. That's the way you can get cure. You asked me a question about how do you deal with these people who believe
who don't adhere to medications.
No, some believe it is spiritual. Even now, I still have some people who think God is not happy with them because they did 1 or 2 things, and they really want to go and have a pastor to pray for them. But you know, the pastors we have, not all of them are genuine.
Yeah.
There are a good number of them are con men.
Yeah.
Even in the medical field, you can get some con doctors. So in almost every area, you find people are praying for you, but they're just trying to see what you pay for the services. So what we do is we really have to do a bit of psychoeducation. We do a bit of counseling to show them that this is where you have. And the important thing is you diagnose the problem proper. If you diagnose the problem proper and you give it the right medication, within a short period, these people see the benefits. When they see the benefits, they will remain with you. They will not go to these other people. But if you really don't go to the right person and you don't get the proper treatment, they will say, I think this problem is not medical. It is something in our culture. There's a taboo. There's something we do not fulfill. Although God is not happy with us. And then you start now moving from one pastor to another. But because it's a mental condition and the pastor cannot handle that, you don't end up benefiting. So what we have done is that sometimes, it depends on the cultural background, if people really believe they are bewitched, I've had them, I've treated them, and when they are well, I tell them, now you can easily go and do it the traditional way, cleansing, so to speak. But so long as you know your doctor, even if you go, you are cleansed, psychologically you are satisfied. So long as we combine, we tell them, you go there, you'll be cleansed, but they still come to us. So we can also engage those traditional people in a way of helping these people.
Traditional healers.
Yeah, so long as they don't tell you stop taking your medicine. If they tell you okay and they don't stop you from taking what you're supposed to take,
to visit them.
We can work in team. We are the Western people, they are the traditionalists. If we work together, we are able to help those people. Because some people are more traditional than others. And until we deal with the traditional line, they are never satisfied. Some people are so spiritual until they have been prayed for. They don't think they will recover. So we can allow them to be prayed for on the condition that they stick to our protocols. When I was in charge of Mathare Mental Hospital, I used to get a lot of people coming wanting to pray for their clients. But they had to seek permission to go and pray for them. And I will caution them that the people, they are not in a position mentally to make a decision on whether to get saved or not. What they need is supportive, the spiritual support. Work hard, God is with you, take your medicines as prescribed, and God is going to liberate you from this disease. So I would allow those who are willing to come and support them spiritually, working together with the institution. So we can work together with the spiritual people. Even some of us are always quoting the Bible when we are trying to give these people hope that God is still with you and God will help you out of this thing. So there's no conflict between the religion and the modern treatment. We work hand in hand. We just try to caution them against those quacks, pastors. But if you get a person who does his theology well, or a Muslim who is really teaching the Quran, we work together without any problems. And even people believe in witchcraft, I'm also able to work with them, so long as they don't go to that extreme. So if you go and the witchcraft is removed, then come, then I'll treat you. And because they are convinced the witchcraft has been neutralized, they do quite well. I think it's a question of learning how to deal with the people, depending on their beliefs. If you are religious, I handle you in a religious manner. If you are very traditional, I handle you in a very traditional manner. So that you are able to take my medicine and you still feel comfortable with your traditional beliefs. Yes.
So the message is you can still live a normal life and this condition is treatable. So you should seek treatment, or the family members, the caregivers should help this person in seeking treatment.
Mental illness of all types is treatable. We have researchers who are working day and night, and they're coming with modern medicines which have less side effects. The original medicines had a lot of side effects which discouraged people from taking medicines. We have very modern medicines with almost minimal side effects. So mental illness is treatable. You are not born with it, and it will go the way it came. What goes up comes down. It cannot remain up. It will go up, it will come down. I want to address the caregivers. If you feel one of your own has got a problem and it is more to do with the mind, don't beat about the bush. Even before you go to see a pastor or a traditional healer, seek a professional on mental health. Basically a psychiatrist, but these days we're also having a little bit of lower candidates of even nurses who are training on Kenya registered nurse stroke mental health. The clinic officers who work in dispensaries and health centers, they are also being given a good input on mental health. What is important is, if you are a caregiver and you believe this person developed a problem after the death of a loved one, or after escaping an accident narrowly, or after fire broke out and this person was lucky to be alive, then next time you see these people sick, when you take them to the hospital, don't beat about the bush. Tell the health worker there was an incident which preceded this thing. So you have already directed the health worker to the root cause of the problem. And the health worker, if they're adequate, they'll handle it. If they cannot handle it, they'll take to a professional psychiatrist, like in Dr. Njagi Commander. So I think if we work together like that one, mental illness will be a treatable condition. It's not like HIV/AIDS. This is treatable like any other disease. And there should be no stigma with mental illness. These days, people can say clearly, I am stressed. There's a time people never used to admit they got stress.
Yeah, it's true.
But these days, people can say, I am stressed.
Yeah,
People can say, I am depressed. So we have gone a long way reducing stigma with mental illness.
Yeah.
is a disease like any other, only that it affects the mind.
Having said that, Daktari, and this is very sad, you'll find some people outside there who label those patients as crazy, but they are not that. Which kind of a message would you like to pass to them?
Now, anybody can be actually affected by mental illness. If the stress, the pressure is enough, and the coping mechanisms are not adequate,
Yeah, no
anybody
one is
can be a
immune to
victim.
stress.
And in fact, most of the people, at one time, you have heard this word, I feel like I'm going crazy.
Yeah.
It's a common term, because at any time in our life, we feel like we are going crazy. So the dividing line between the normal and abnormal is not that big. In fact, those people who shout loudest, I'm not mad like you, I think they have a problem. They are more or less scapegoating, calling you mad, so that themselves they say they are not mad.
Yes.
So I think anybody stressed enough can go to that stage where you get some kind of a temporary mental insanity. That one is very common. There are many people, you behave abnormally, you are forgetting things, you don't know where you are, but it's short-lived. In fact, it's only when it has been there for at least 2 weeks, non-stop. That's the time we call it mental illness. But you might wake up on a day when everything is going wrong.
Yeah.
You're so forgetful and you can't even remember somebody's name. And today you're abnormal. But if it is persistent, that's it, we call it a disease. Or the other is those short-lived temporary things. Those ones are normal with all of us. So all of us at one time we behave like we are not ourselves. It's only when it is continuous for a longer period. We see this person is mentally sick. So whoever is laughing at a mentally sick person, maybe that person has got a problem.
Himself or
that
herself.
problem has got a problem, himself or herself. If you are yourself, you can understand.
Yeah.
This is part of life. Yes.
Okay.
Good.
Do you have anything else that you'd like to add?
Not quite, not much, but let me say, we talked about the environment. The environment will come in many ways. Things like poverty, things like lack of employment for young people who are graduates. You want to start your life, you can't start because of lack of amenities.
I think that is the main
Those
reason
conditions
that
are
is stressing
bringing these things. Let me say sometimes our leadership may not be addressing these things very well. And we should also ensure we have the right leadership, because most of them they're elected anyway. I think it's the high time we try to elect good leaders and we don't glorify corruption.
Yeah.
Because corruption has been glorified. It's like unless you are a bit shrewd and outsmart others, you cannot get along. I think you can get along through handwork. You can live a better lifestyle than you are brought up through handwork. Handwork pays. Let us practice meritocracy. Those who are fit for positions, let them get them. That will motivate those who are not working hard to work harder. But you can imagine if you are doing better than so and so, that person who is worse and who is given a job higher than you,
It will demoralize
you
you.
become so demoralized. So we have societal issues which we should try to sort as we move on. And I'm sure if we make this country better, recognize the rights and needs of every person, things like mental illness will come down drastically.
The cases
The other
where
thing, of course, we
drugs-
need also to look at is drug abuse. Some of these things we take, they have negative effects. But these are things we can avoid.
Yeah, and also about drug abuse, I think in this country, like alcohol, you can acquire it easily. It's not expensive. You don't need to prove your age. I think you can address such things.
Yeah, alcohol, you know, it has been with us for a long time.
Yeah.
And it has become part of our culture.
Yeah.
And what is happening as life becomes more complicated, because normally tunasemanga baada ya kazi, you know, you relax after hard work. So it's like if things are too hard, you tend to go back to alcohol to try and console yourself. But it is addictive in nature. So in the end, even if you know you are not consoling yourself, it start calling you to go ahead and take it. Yes. So we are here. We are trying our level best. We cannot finish the problem of this country. I would ask many people, many young people, to go to courses where you do some work on mental health, so that you can take over from some of us who feel
when
that
you retire.
we need young people now to come in to try and help others. Yeah? But we are still having some energy. We are still helping, like you found me at my place of work. And
You were working, you were busy with
you
patients.
found me working busy with the patients. I'll
Yeah.
continue going. And those who may have heard me talking, and if you remember, I can be able to be of some use to them. I'm also available on phone. One can call 0714 788 000.
You can repeat.
0714 788 000. And there you'll be able to get help, or you get my assistant who can be able to direct you on where to go for help. Yes.
I'm really thankful for hosting you, and I hope it's not the first and the last time. Yeah.
We have talked about bipolar disorder. There are many other conditions.
Yeah.
Feel free. If you feel we can also talk about the other conditions, depression, even schizophrenia. We can talk about all those. And also substance abuse, because it can be a topic by itself.
Yeah, it's true.
Okay.
Especially alcohol use disorder.
Especially
It's an area of interest
use
in this
disorder.
country. I think it has affected a lot of people, especially men.
No, very much, very much. There are some places now, even if you were to be buried, there are no young men to dig
The
the
grave.
grave. The old men are struggling to bury their old men by digging the grave, because the young men are in the valleys drinking the local brews, simply because they cannot afford the industrial ones. Alcohol use is rampant. It is not use, it is abuse, because we are using it excessively. These are some of the things we can talk and advise people on the various ways of reducing the consumption of alcohol. We cannot ban it because it is legal, but we can advise people on how to reduce and what to do if you become afflicted by alcohol and any other drugs like marijuana or even other substances of abuse. Good.
Yeah, I'm really thankful.
Okay.
Yeah, till next time. Bye-bye.